Okay, so I'm going to be demonstrating how to determine arterial occlusion pressure, also known as AOP or limb occlusion pressure. And it's important to figure out AOP because it's the only real way that we have to standardize how we're doing blood flow restriction training. So BFR entails full venous occlusion, which means that we're completely restricting blood back towards the heart on the target extremity, whether that be the upper body, the arms, or the lower body, the legs, as well as partial arterial occlusion. So we're cutting off a significant amount of blood flow from the arteries, so going from the heart out to the extremity, but not completely, because if we completely cut it off, we're increasing the chance of risk for things like ischemia or damage to the vascular walls in individuals that are predisposed to those types of incidences, so people that have hypertension, peripheral artery disease, etc. And at the same time, if you're just using BFR recreationally, then you might not be getting a robust enough stimulus because you're not allowing yourself the blood flow to facilitate the endurance to continue a set or enough repetitions in that set to garner a proper amount of stimulus. So I wanted to start off by demonstrating how to use an ultrasound Doppler. This is a Doppler. You might be familiar with it in that you may have seen it when you're at your OBGYN appointment or in a hospital setting. It's a lot more compact than your typical large-scale ultrasound. And what it does is allows us to hear the oscillations in blood flow using this probe and a little speaker that's actually attached to the Doppler itself. So this is the probe. The probe goes on top of the artery. We're going to do arms and legs today. I wanted to start off with the arms just because it's a very common place for individuals to do BFR training. You're also going to want to make sure that you have a little bit of ultrasound gel. You're going to try to put that over the area where you're going to be listening to the sounds of blood flow in the target artery. So the first artery that we're going to try to find is the brachial artery. You can see here that we have our equipment set up. So this is the bands that we're going to be using today, the BFR bands. These are the B3 bands. They're a narrow elastic band. They're a little contrasted to your typical tourniquet style wide rigid cuff that you would typically kind of see parallel to a tourniquet used in a blood pressure measuring scenario in your doctor's office. And a lot of the American products are also wide rigid cuffs. This is also an American product, but it's meant to kind of mimic the narrow elastic types of bands that were originally used when BFR was first starting to come around, called the Katsu bands. It just means that they require a little bit more pressure to find that point, that AOP, which is the point where all the blood flow is cut off. So we're going to find the blood flow cutoff point, the AOP, and then we're going to dial back on that using a percentage range. So between 40 and 80%. For the lower body, you want to use a slightly higher percentage. For the upper body, a slightly lower percentage. So typically with the upper body, it's recommended that you're using somewhere around 40%. You might want to go a little bit lower than that if you have any contraindications, hypertension, any of the cardiovascular diseases that I had mentioned before, or if you're just kind of new to BFR and trying to figure out what the optimal percentage is for you in order to attain your performance benefit goals, hypertrophy, strength, maybe you're even looking for some type of muscular endurance goal out of BFR. Regardless, it's important to objectively measure your AOP. So we have the ultrasound gel. We're just going to require a little bit of that right on top of the target area. You can see the big vessel right here. That's the median cubital vein. We don't want to go for a vein. We're not going to be measuring blood flow in a vein because when we're doing BFR, objectively, we want to cut off all blood flow in there in the first place. So we want to try to find the artery. So I'm going to kind of put a wide swath of ultrasound gel there, and we're going to try to find the best signal for the sound of the brachial artery. So turning the ultrasound on. So we found the brachial artery. We're going to go ahead and we're going to very slowly pump it up to the point where we can no longer hear the sounds coming from the ultrasound Doppler. We're going to go up by about 10 to 20 millimeters of mercury at a time. That way we can determine that point and not have to pull back. So we're going to keep going up until we can no longer hear it. good that the sounds are petering out. A little bit more. All right, and all the blood flow is cut off at what point?
250.
At around 250 millimeters of mercury. So what you would want to do is you would want to base your percentages off of that number. Okay? All right, and always remember, if you're working with, let's say that this was actually dialed down to 40% of that number, let's actually go down to around 115, because that's going to be around 50%. I said 15%, I meant 50%. Good. What you're going to want to do is you don't want to be exercising with this fig attached to it, so we're going to be disconnecting this part. You're going to lose a little bit of pressure by doing that, but it's still going to be effective. Okay, so this would be the amount of pressure you'd be working out at. Just make sure that you wipe the ultrasound gel off. Okay. All right, so in order to determine AOP utilizing ultrasound Doppler, first what you're going to need to do is take your cuff. You're going to need to tighten your cuff as proximal to the torso as possible. So we want to go as high to the hip as possible because we're trying to get as much of the leg musculature involved as possible when we're talking about cutting off blood flow. Obviously, we're not going to be exercising with cut off blood flow. We're going to be pulling back like I had mentioned before. So what we want to do is we're going to tighten the cuff up and we're going to attach our sphig. Okay, so our sphig is going to attach hopefully by some type of pump-mediated mechanism. And that's going to allow us to objectively measure the amount of pressure in millimeters of mercury that's going into the cuff. So we're going to go ahead, get a little bit closer here, and we're going to be able to see how to use the ultrasound Doppler. So your ultrasound Doppler has the main component right here. You're going to be hearing blood flow through the ultrasound Doppler, and the objective, as you might imagine, is that we're going to pump up the cuff until we can't hear blood flow any longer. The probe is going to go, it can go in a couple of different places. If you're using a proper ultrasound, it can go in the femoral artery, which is on the upper portion of your leg, on the inside of the upper portion of your leg. But if we're looking at the tibial artery, which has been validated for the ultrasound Doppler, and I think it's a much more convenient place to look when using this technology, we're going to find the medial malleolus, which is the bony protrusion of our foot right here. And then we're going to go directly posterior and then superior, so a little bit behind and above. Now we're going to take the probe and we're going to find, first, what would be really helpful is if we took a little ultrasound gel, allow us to get a good signal. So you don't need too much, just a little dab there, because we kind of have an idea of already of where we're going to need to go. And we want to very firmly, don't be too gentle with this, we want to very firmly listen for the best signal that we can get. So we know where it is, you might need to play around a little bit, but also once you do start hearing the noise, if you can hear that, the sound of the blood flow, the oscillatory sounds of the blood, so we want to make sure that once we hear that sound that we rotate a little bit and make sure that we're getting the best possible, most robust noise possible. Okay. So that is very, very loud, very good. We want to press down nice and firmly so that we can keep that signal. Good. Then we're going to take our sphig here and start pumping up. Okay, so we're going to go very slowly. We're going to go 10 millimeters of mercury at a time. That'll allow us to really determine where that point is. And I'm going to tighten that first. You're going to start to hear those sounds petering out. Barely anything left. Just a little bit more. And I would say all the sounds are gone at around 310. If we let it just naturally fall a little bit, when it gets to around 300, we start to hear those noises again. So 310 is going to be the number. So all you have to do is take between 40 and 80% of that number, and that's going to be your working AOP. What I would do is I would measure that every day when you're training until you get a good idea of the variability between the measurements. And then I would switch to a weekly basis. If you're not very variable there either, I would switch to a monthly basis, but I would preferably do somewhere between once every week to once every 2 weeks, just because if you're actively training, you might get some degree of muscle swelling or edema based on exercise that could affect the amount of pressure that's necessary, because you're changing the width or the diameter of the muscle based on the fluid. Okay. All right, so hopefully you are now just a little bit more equipped on how to utilize BFR safely and effectively. It's really important that we figure out how to standardize BFR as as upcoming ubiquitous practice in training and kind of gym culture in general. And I think that moving forward, we should also try to discourage the use of products that are much less reliable. So knee wraps, things of that nature, where we really can't objectively measure the pressure that's going inside of the cuff. So the ultrasound Doppler is going to be your best bet when it comes to trying to figure out the most accurate and reliable way to determine arterial occlusion pressure, or AOP. You'll now have everything that is required, but you will have to purchase an ultrasound Doppler, which can kind of cost somewhere in the range of maybe $50 to $150 to $200 at some places. So it is a little bit more of an expensive investment alongside the cuffs, but I definitely think that it's worthwhile.